Time now for a look at your health. We brought you the stunning findings yesterday that 84% of all fish have unsafe levels of mercury, and yet we're told fish is an important part of our diet. So which types of fish should we really avoid and which are a little bit safer? Joining us now to sort all of that out is Dr. Mitchel Goldman from UCSD. Thank you for being here.
Good to be here.
Let's get right to it because seafood lovers abound here in San Diego. So which fish should we avoid?
Essentially, avoid the old fish and the big fish, because what ends up happening is mercury comes from a large number of things. It comes from mines, it comes from air pollution, from volcanoes, from lots of different sources. And the little fish and krill tend to eat the stuff that has the mercury in it. Then when the bigger fish eat it and the older fish eat more of the little fish, it just accumulates. But that doesn't mean fish is bad. I had sushi last night at my favorite sushi place. So you just have to limit what you're eating.
And we have this graphic up that really shows that cycle you just explained. And top of the list you had mackerel and marlin and shark and swordfish, and of course tuna is a really big and popular one here. But how do you know that you actually are suffering from mercury poisoning? Because the symptoms aren't necessarily obvious, are they?
Kathleen, that's a good point. You know, I had an elevated mercury level. My wife did, and my best friend. And what we noticed is that we had a little bit of tingling in our fingertips, maybe a little bit of a tremor, and of course a physician doesn't want to have that. And then sometimes you get a little more nervous, a little more difficulty falling asleep, a little more disorientation, and it sort of added up. And what we did is I actually got a blood test, and it's very, very simple. Ask your physician, test my mercury. It is a blood test. It's a special test, so it has to be drawn up in a special tube, sent to a lab, and my mercury level was elevated. And so what do you do at that point? Now, there's lots of intravenous chelation therapies, but I didn't want to do that because there's lots of side effects, they're expensive, and so the easiest thing to do is just stop eating the bad fish for a little bit, and within a few months, everything comes back to normal.
So what are some of the things that we can actually have on our plate in terms of fish that are of the safer variety?
Seafood like crabs and shrimp are really good. So anything small is really good. Fish the smallest fish are really good. Salmon is really good. Light tuna instead of the albacore tuna is good. But you know, remember, even if you're going to have regular tuna or big-eye tuna, you can have it once in a while. It's just what happens is if you get in a kick, like you've got these phenomenal sushi restaurants in San Diego, and you just go out and you have sushi like every single night or 3 or 4 times a week, that's when it starts to get problematic. So like everything in life, just limit what you're doing. You know, I love sushi. I had it last night. Once or twice a week is fine, but try to do the smaller types of fish.
And the factors are the same whether you're talking freshwater or ocean water?
It is mostly ocean water. Freshwater, if it's farm raised or raised in a lake, it's actually going to be pretty good. So farm raised fish is probably the best fish to eat because they're not eating other fish, and they're eating more of a controlled diet that is low in mercury. Now let's go one step further. You know, a lot of people are taking omega acids and salmon pills.
Fish oils.
So make sure that when you're taking fish oils, the mercury level is actually in the pills.
Is that right?
Yes, and so you can go and just look at the mercury levels in the pills. Obviously, farm-raised salmon pills are the ones I actually take because they probably have they do have the lowest amount of mercury. But just be careful, and you can enjoy your fish, enjoy your sushi.
But be cognizant of it and everything in moderation.
And if the first things you usually notice are the tingling in the hands. As soon as you start noticing something like that, just go see your physician, request a mercury test. Because like when my friend was having the symptoms, went to the doctor had no clue what was going on, and we were talking about it, and I said, look, get a mercury test, and that's when it happens. So sometimes your doctor may not be aware,
right.
So please request the test.
Be your own advocate. All right, as usual, thank you very much. Another eye-opening discussion, and Lauren, I know you're a big seafood lover as well, so important for you to take note.
Yes, I'll be watching my fingers carefully. Thank you.